everybody, happy Monday. The lecture today is going to be on, or this little Facebook Live, is going to be on stress and chronic disease. Now, a lot of the lectures that I do, or talks that I do, I almost always say this is a really important one, but this one, it has very, I would say huge implications to your health. So I'm going to go through the common stressors and the umbrella of those. So it's going to be chemical, emotional, and physical stress to the human body. I'm going to talk about the mechanism of what actually happens in the body. And I do this with a lot of my patients, even one-on-one, just because of the stressors that we endure today. Most people are under great deals of stress. So this is a good lecture for them, even one-on-one. So we'll go through the mechanisms physiologically of what happens in your body. I'll talk to you then about the implications, what happens as a result of this stress. And, we'll talk about immune dysregulation. We'll talk about its effect on insulin levels and your blood sugar. We'll talk about the effect on the stomach, etc. So I'll go through that, and then we'll talk about how to mitigate those, what solutions you can do to help with the stress response for chemical, physical, and emotional stressors. So we'll break those down. And then at the end, I'm going to talk about supplements and what to use and how helpful those can be for you. Okay? So that's a breakdown of the lecture. But let's start by talking about the stress response. So again, we could have chemical stressors, physical stressors, and emotional stressors. So most of us think about stress in the emotional form. Finances, family matters, work stress, things like that, your day-to-day life. But the chemical and the physical stressors perhaps are as or more important than just the emotional. So I want to open your eyes to that. But let's talk about the mechanism. So if I'm fight or flight, okay, let's talk about fight or flight. If I'm attacked by, say, a lion, so this goes back to survival mechanism, right? They call it the sympathetic or fight or flight response. I have to produce, or my body will produce, in order to survive, it will produce chemistry that gives me almost superhuman strength, right? And you hear these stories about people under great deals of acute stress, picking cars up off of people, etc. So there is chemistry that's secreted by your pituitary gland, by some cells of your body that will produce these stress hormones. And it's a good thing a lot of times. It's a survival mechanism. However, if we have chronic stress, which is done day after day, that's when this becomes detrimental. So I'll explain. I have this lion that's chasing me, right? This acute stress response kicks in. I get this ton of abundance of energy to be able to fight. If I live, I fight or flight, right? I either run like heck or I fight like heck. If I survive, right, the energy that I produced during that fight or flight brings me back to equilibrium, meaning I burned off all that chemistry, and now my parasympathetic, which is called rest and digest, right? Your sympathetic was on, which is called your fight or flight. That's what responds to the stress mechanism. And then I burn off that chemistry by doing the fight or flight, and the parasympathetic, or rest and digest, kind of brings me back to equilibrium again, or balance. And I'm okay, that's a good stress response. However, if it becomes chronic, if I'm under chronic stress, like we talked about, chronic chemical, physical, or emotional stress, that stress response is now atypical for the human body. It's no longer a survival mechanism. Well, it is, but now it's on too much and too long. So here's what happens, okay? I am introduced to a chronic stressor. Say I'm going through a divorce, I'm having problems with family, chemical stressors, I'm eating poor food, bad foods that have a lot of chemicals in them, etc., right? And it becomes a chronic stress response. Illnesses are also chronic stress response as well. So I'm going through this chronic stress response. What happens in the body is cortisol in the acute stress response is released in high amounts. So I'm getting chased by this lion, right? Cortisol increases dramatically, and it's there to help me survive. All right. If I have chronic stress, what happens is over time, the cortisol cannot keep up. The adrenal glands can't keep up the response. So my cortisol starts to go down, and I become fatigued. It's called adrenal fatigue, and it's called functional adrenal fatigue. So as that happens, okay, in the mechanism, my cortisol starts to dip low. I'm going to start using other hormones in order to keep up with the stress response. So I'll use pregnenolone as one of them, and it's called the pregnenolone or progesterone steal, which I'll start to steal these hormones and convert them into cortisol to keep up with the cortisol response. Now, pregnenolone is a precursor to progesterone. Another hormone, DHEA, can either go up, and usually it goes up in order to help that stress response as well. So we get alterations in other hormones that are designed to keep up with this stress response. Now, let me talk about what happens chronically. If this is a chronic response, which means been going on for years and years, cortisol goes down, my hormones go down, and now I don't have any chemistry to support the stress response. So the old term for this that I used to hear growing up is a nervous breakdown. It basically means your stress, right, overcomes your response, meaning you don't have enough chemistry to respond to that stress response. So let me go over some symptoms of this adrenal fatigue, if you will. We have the inability to get to sleep for some people. Their circadian rhythm is reversed. We can't stay asleep. Okay, we have low blood sugar. We could have low blood pressure. And low blood sugar symptoms are, I get hangry. If I miss meals, I get shaky, jittery, irritable, hangry, if you will. I could be tired upon waking, even if I had good sleep. I have afternoon fatigue. I could have anxiety, depression. And then the one that's the feedback that I get consistently is my ability to handle stress has gone away. Meaning, I used to be this calm, cool, collected person, but now every little thing gets to me. I'm jumpy at sounds, etc. Those are all symptoms of this adrenal fatigue, okay? And so when those hormones start to decrease, that's going to create some of these symptoms for you, okay? So that's just an intro into how you can identify if you have this, and most of you do. I've been doing this probably functional med 10, 15 years now in between, and I can tell you most of my patients have some type of adrenal fatigue, okay, or stress response going on that's become chronic. Okay, the other aspect that happens is part of the brain, and you can look this up, it's called the HP axis, the hypothalamic pituitary axis. That part of the brain gets affected by the stress response, and what happens is it no longer responds to low levels of these hormones. So your pituitary gland is responsible for growth hormone, thyroid stimulating hormone, ACTH, which is a precursor to your adrenal hormones, and FSH and LH, which are your precursors to your sex hormones. So if the pituitary gland isn't getting those messages that you're low on these hormones, then it's not going to increase these hormones that I just mentioned to make more, say, cortisol or make more testosterone or progesterone or what have you. So the HP axis becomes affected, and that, I use the term, it short circuits. Instead of it's like so not only do we have an area of our brain not responding to the low levels of hormone, we also have at the cellular level low hormone levels from this chronic stress response. So when I talk about how to mitigate this and solutions for it, part of it are supplements that help the HP axis. Part of it are supplements that help get more cortisol in the blood. Okay, and we'll talk about that in just a minute. All right, here's the kicker as far as how chronic stress affects you with chronic disease. All right, the number one thing that happens is with this chronic stress response and this cortisol is my immune system starts to go haywire. It becomes dysregulated. So number one, we get an increase of circulating hormone or proteins and cytokines that are inflammatory. So something called NF-κB are inflammatory cytokines, prostaglandins, things like that. They go way up that create a chronic inflammatory response in my body. Okay, that's a big deal. But even the bigger factor with the immune system is this response increases something called suppressor T cells. So suppressor T cells in your immune system are designed to make sure you don't get an overactive immune response. right? So they suppress, so you have a check and balance in your immune system. You have attackers, your Th1 pathway, your attackers, your T cells, then you have suppressor T cells that are supposed to counterbalance. But with this chronic stress response and this cortisol-driven response, we get an increase in these suppressor T cells that's not suppressing, or that's over suppressing your immune system. So it makes you more prone to chronic infection and chronic disease, say, for instance, like a cancer, okay, like autoimmune conditions, etc. So in short, your immune system becomes dysregulated. We get overactive inflammatory response, and we get a suppression, if you will, because of too many suppressor T cells, of your immune response, okay? So they call that immune dysregulation. That's one of the key primary outcomes negatively of having this chronic stress response. In addition, my cortisol is going to shift, which is going to shift insulin levels. So people with chronic stress response are going to have a predisposition, if you will, to diabetes, okay? Either type 2 usually, but even type 1, which is an autoimmune condition, all right? So insulin, inability to either utilize insulin at the cellular level, or maybe your pancreas isn't making enough, that's a byproduct of this stress response as well. Additionally, we get a overactive digestive response. So your digestive system is under what they call parasympathetic or rest and digest, right? It's under that, mainly that nervous system. However, when we increase the stress response or our sympathetic response, fight or flight, it causes it overrides, if you will, that parasympathetic response. So what happens is we get that nervous stomach. And what that means is we produce more juices, more hydrochloric acid, etc., which predisposes us to ulcers, duodenal ulcers, peptic ulcers, etc. So the gut and the digestive system become very much involved, especially the stomach. In addition, the inflammatory response starts to create what they call leaky gut or intestinal permeability. So inflammation is the number one cause of intestinal permeability. Okay, so now our digestive system starts to get involved heavily. Furthermore, another detriment to the stress response is the fact that my brain will decrease, or the use of, or the ability to make in the body and utilize at the brain level are neurotransmitters, right? So we have a brain issue now. We could have depression, we could have anxiety, but that's also in conjunction with having cortisol issues and issues with your hormones that help with anxiety and depression and things like that, and your neurotransmitters. So the brain gets involved. So we get the anxiety, depression, etc. So the point I want to make is this stress response, A, there's chemistry involved and why it happens, and B, there's detriments that happen in the human body physiologically that predispose you to chronic disease. So again, just to review, the immune system becomes dysregulated, our gut health becomes faulty, we have issues with brain function, issues with blood sugar. So you could see if this goes on long enough without being corrected or mitigated, we're going to start breaking down and degenerating. But more importantly, and that's at the cellular level, more importantly, we're going to have an immune system that is now dysregulated that leads us to chronic diseases, okay? All of them, and cancer being a big one, autoimmune conditions, etc., okay? So I wanted to map that out for you so you could get an understanding, okay, this is what happens. All right, now, let's talk about some solutions, because we want to break down chemical stress, emotional stress, and physical stress. So let's start with chemical stress and what we can do about it. Well, chemical stressors come in all different shapes and forms, right? So our food supply is probably the number one way that we can control how much chemical stress is to our body, right? So things like herbicides, pesticides, fungicides that are put on our fruits and vegetables and our food supply, we can reduce that simply by starting to buy more organic fruits and vegetables. Anything with skin on them that we're going to eat, that's more important, okay? So if you want to pick and choose your battles, buy organic with things that will have skins on them, right? Whether it's apples, your berries like strawberries, blueberries, raspberries, things like that. So if they have a skin and you're going to consume it, Organic is better because it's going to be free of those herbicides, pesticides, and fungicides. All right, so that's a big deal. Not only that, eat organic, free roaming if you can, meats, because they're going to have less chemicals added to those, whether it's antibiotics or what have you. Okay, so your food supply is the number one way you can control it. Number two are your products that you use on your skin, right? Whether it's creams and makeups for women, or your shampoos, etc., detergents. Think about those and the chemicals that we're exposed to. And when we're using it on our skin, the cells, it absorbs through our skin cells into our environment. So it increases our chemical stress to the body. All right, so it's a big deal. I know in the Perfectly Healthy store, we have a lot of products, skincare products, I believe shampoos and things like that, sprays for your sunscreens, etc., that won't have a lot of those chemicals in them. So check that out for sure, and it's kind of a big deal, okay? The other one that's not really a chemical, but electromagnetic radiation that comes from the cell towers, comes from our TVs, it comes from our cell phones, etc. There are ways to mitigate your exposure to that, whether it's covers or pads or things like that. Again, the store, the Perfectly Healthy store, not to just promote the store, but I know we have those things because we understand chemical stressors and electromagnetic radiation and how that affects you. So we try to stay consistent with our motto, which is low chemical stress as much as we possibly can, because we know the ill effects. Okay? All right. Second, physical stressors. Okay, what can you do about physical stressors? Here you go. Well, there's massage therapy, right? There's chiropractic care to get structure and function and alignment better. There are resources here at the clinic like Equiscope. Anita does Equiscope. Dr. Bales will do PEMF. We have hyperbaric oxygen therapy. We have all kinds of resources that will help mitigate the physical stress response. That's where I feel this clinic wins, because the resources, I haven't seen a clinic that has as many resources as this clinic has to help mitigate a lot of that physical stress response, okay? So that's physical stress. Emotional stress is probably, one of the bigger deals here. So the things that need to be done or should be done is to talk to people, if you need to see somebody about some of these stress response. I mean, ideally we try to remove the stressor, right? But a lot of people that I've talked to over the years, it's very difficult to do. So what we want to do is, if we can't remove it, we have to deal with it and minimize the downside. So for instance, at the clinic, Liliana does EVOX. Virginia Dixon does emotional therapy. That works really, really well. Meditation is very, very good. Prayer is very, very good. Community work. They've done research that a sense of community and being in, I guess, community groups that a lot of people are going through similar issues or problems tends to help a lot, because you get to communicate about it. So those community groups are also a big deal as well. So they're just some strategies to help mitigate the downside of the chemical, physical, and emotional stressors, okay? They're not end-all be-alls, I understand that, but at least it's something to help. All right, the fourth thing I'm going to talk about are what can you do and what can you take to mitigate this response from a supplement herb standpoint, because with most of the patients that I've ever seen, I have them on these supplements, and they work really, really well. But before I get to that, let me just state this. Your stress response is going on because of causes over here, okay? So we can band-aid this stress response, but ideally, if we're gonna get this right so you don't need the band-aid anymore, we really have to try to get rid of the stressors and identify them as much as possible. Now again, some people are going through some rough stuff, some rough traumatic events, illnesses, emotional stressors, etc., that really can't be dealt with right now. So all we do is let them know you might be on these band-aids for quite a while, okay? And I will tell you, I have, and even personally, I'll take my adrenal support throughout the week, maybe not every day, but working out too hard can create adrenal fatigue. and the stressors that we go through life every day. So I take some to just help mitigate some of the stress response because I think it's super important. Okay, so having said that, let's talk about some supplementation. So if you remember us talking about the HP axis in the brain, okay, it's the hypothalamic pituitary axis. That area responds to low cortisol, low TSH, growth hormone, etc. But again, sometimes it gets short-circuited by the amount of stress that goes on, and it doesn't work well, so it doesn't respond well. There are things called adaptogens that are out there, right? And you can look that up, adaptogens. And adaptogens help support the HP axis. And what it will do is it will just take the short circuit and get it going, right? To keep it as simple as possible. Those adaptogens can include Siberian ginseng, Chinese ginseng, ashwagandha, cordyceps, maca root. I mean, the list goes on and on. But what I would recommend is finding a product that has a lot of those adaptogens in one product. I'm not a big fan of taking one of those products individually because when you combine them, you combine the strength of the product. And sometimes you need multiple adaptogens in one product to help that stress response. So that's personally what I recommend to patients. All right, the second thing that I recommend is actual adrenal support. So there's products that I know, one's called A-Adrenal, Designs for Health has adrenal complex, Apex Energetics that I use has something called Adrenozyme. And what they contain bovine adrenals, okay? So you get actual adrenal support from the bovine. Now, some of them also have, the ones I like a lot, have porcine spleen and thymus because they will help increase or regulate your immune response as well. So those two products, an adaptogen or adaptogens in one product, and some adrenal support, which is at the cellular level, will help mitigate a lot of that stress response and at least help it temporarily while you work through the stressors, the causes. I hope that makes sense. But going back to the symptoms, it will help sleep significantly. And let me talk about, let's see, time-wise. We're good. Maybe a 5-minute conversation here. Sleep. Here's how it works. At night, when the sun goes down, my cortisol levels are supposed to drop. They drop, and it's supposed to kick on melatonin, which rises, and that helps you fall asleep, okay? Throughout the night, what should happen is, as time goes on, my blood sugar will drop a little bit because maybe I haven't eaten since 5 or 6 o'clock. So I'm starting to get in a fasting phase. And so what the adrenals will do is secrete a little bit of cortisol to pull glucose from the liver into the bloodstream during the night to regulate your blood sugar levels. But if my cortisol's low, my hypoglycemia kicks in, right? My blood sugar keeps dropping, and then catecholamines like epinephrine and norepinephrine are released, and I'm wide awake in the middle of the night. So that mechanism of getting to sleep and staying asleep has to do with cortisol and has to do with, in the middle of the night, your insulin response and your blood sugar levels, okay? So then, when I get up in the morning, or let me back up, when the sun comes up in the morning, what should happen is my cortisol should be at the highest level of the day, and my melatonin should then drop. So basically, cortisol stimulates melatonin at night to either go up and in the morning to go down, all right? So if you need melatonin, it's usually related to a primary cortisol mechanism. Okay, just wanted to throw that in there because I see a lot of people on melatonin. Okay, so in the morning, sun comes up, my cortisol should be at its highest level, melatonin should drop, and I should be kind of bright-eyed and bushy-tailed, ready to go. But if you're lagging significantly in the morning, it's probably because this cortisol is low and it's not kicking in. So your motor's not firing, okay? Takes you a while to get going. Then in the afternoon, your cortisol drops and you get fatigued in the afternoon. So we need naps constantly, etc. So what I just explained is what they call the circadian rhythm, your sleep-wake cycle. That's how cortisol affects it, how the blood sugar is affected, etc. That creates a sleep problem, okay? So those adrenal adaptogens and adrenal support really help those. But then to help it even further, or to take that even further, it's going to help your anxiety, it's going to help your depression, etc. At times, when we do testing, okay, and I'm going to touch on this briefly. Saliva test is the most beneficial test for cortisol, DHEA, pregnenolone. The reason why is blood testing is very insensitive to cortisol. So saliva is up to 100 times more sensitive. A lot of times blood draws of cortisol will only pick up major deviations, and that's like Addison's disease or Cushing's disease. So the saliva test will pick up these functional deviations because it's so much more sensitive. So we'll test these. Now, at times, I may, beyond the adaptogens and the adrenals, I may also recommend short-term some progesterone or some DHEA, depending on what the testing shows. So if women start to get low on, especially women, start to get low on progesterone because of the steal that I mentioned, where we're stealing pregnenolone and progesterone to keep up with cortisol, that's going to leave you open to something called estrogen dominance, which is, you don't want to be estrogen dominant for a number of reasons beyond symptoms, but the main one is those estrogens, especially estradiol, are very proliferative to breast tissue and uterine tissue. So this mechanism is one of the number one mechanisms that create problems with uterine fibroids and cysts, and then even cancerous tumors in breast and uterine tissue. It's because the progesterone is not counteracting the negative effects of estrogen, okay? So in a balance, they're very good. Imbalance, no good. This mechanism is big, a big result of that. The other thing is when women start to get low on progesterone, they get more susceptible to osteopenia and osteoporosis. And this is another main mechanism as to why. Progesterone, just quite simply, is one of your main initiators to bone building, okay? So big deal. All right, so there are other things that I may recommend, again, with the adaptogens and the adrenals, and that has to do with DHEA, pregnenolone, and progesterone, but it all depends on what the saliva test shows, okay? So that's the best one to have, just in case, to give you some tools in the toolbox that you could ask your doctors or your physicians about. Okay, so just to recap, let's recap. Number one, chemical, physical, and emotional stressors. All right, we talked about those. Number two, the mechanism of cortisol up initially in the acute response, but then it becomes fatigued. So your cortisol levels start to drop. We start to convert other hormones to keep up with cortisol. The more that chronic stress response is there, the more these levels drop, and the more symptoms that you're going to have, okay? We talked about the HP axis, how the brain, the hypothalamic pituitary axis gets involved and short circuits, so it no longer responds to low levels, and so it no longer can keep up. So we take adaptogens for that. We talked about the detriments, right? We talked about the immune system and the dysregulation that occurs. We talked about the stomach and what happens with the stomach and the digestive system. We talked about your insulin and what happens to blood sugar. We talked about the brain and your anxiety and depression and things like that could occur from it. Now, having said that, there are other reasons for some of these symptoms, but this is just a main one that happens in an area that we look at initially. And don't forget, when you get these hormonal imbalances, that's going to create those things as well. So we talked about the detriment of this stress response, and then we talked about what to do, chemical, physical, and emotional stressors. And we talked about some supplementation that could be done, okay? So hopefully you can watch this over and over again, obviously, but that gives you some tools in the toolbox and a better understanding of how detrimental this stress response could be. So if you need help with it, talk to your doctors here, right? Or your doctors, whoever you're working with, but just understand conventionally, the conventional doctors don't understand this very well because they're usually testing it via blood. And when they're testing it via blood, it rarely comes back positive unless it's a pathological condition like Addison's or Cushing's. So conventionally, they don't recognize this response much, okay? So you're gonna have to sometimes go outside of the box. The doctors here at the clinic understand that very, very well, okay? If you need help personally, let me know. I'll be happy to help you in any way we can. The number is 949-680-1880. You can always call and just ask questions. We'll do a follow-up